If you're doing these exercises that we're going to talk about today, then you need to stop these. It's not going to work for your back pain. Back pain is one of those things that can really put a damp on your daily activities, your daily life. It's like you wake up in the morning and even before you get out of bed, you can feel it. It's a nagging ache that just doesn't seem to go away. And it's not just about the pain itself. It's about how it affects everything you do. From simple tasks like bending down to pick something up, to more complex activities like going for a run, or even just sitting at your desk working. Back pain can really take away from your daily life. And what's even a bigger problem is how our healthcare system treats back pain. It's horrible. We're going to talk about the exercises that I can predict when people come into my office and why they don't work, as well as what you should be doing starting today to start solving your back pain. So the first thing we're going to do is actually get into the exercises that I see are given out all the time. And then we're going to talk about why those don't work. And then we're going to get into some things that actually do work. So first thing, when people have back pain, all you want to do, you want to bring your knees to your chest. And so the reason why people do this is because they are wanting to stretch the muscles that are tight in the back. And so this is one that people are given, one that we should not be doing the majority of the time. Now there's times when this exercise is appropriate. We're not going to be talking about a video today where these would be appropriate. We're going to be talking about like other things that you should be doing that really the majority of the time will work for most people. So bring your knees to the chest is one thing. They'll do things where you're to the side, stretching this direction, and then stretching this direction. We'll do the other exercises will be hamstring stretches, all those kind of things. And then the other thing will be getting into core strengthening. Now, we often find when people try to strengthen their back and their hips, sometimes this actually makes them worse because usually what happens, in our healthcare system, we're not actually getting to the source of the problem. And so we're just treating all these different symptoms. And I'm going to explain it to you from a picture perspective. So we can see that this is where the disc is and you have bones above and below, and then you have nerves that come off to the side. Now, a lot of times, because if this disc, you can bend in all different directions and it can move the material around. Oftentimes, what happens throughout the day of what we do all the time is we're always bending. We're bending forward, we're sitting, we're doing these in prolonged periods of time. It's kind of like if I pull my finger back and I hold it back day after day, year after year, because I'm sitting in front of a computer, then my joints aren't going to like this. And it has to come out of that position to start recovering. But what happens as we get older, we don't recover as fast, and then we go right back into the position. And then eventually one day you wake up and you're like, oh my God, I have all this pain. Or you put socks in your drawer and your back seizes up. That's not when the problem started. The problem has been accumulating over the years that's creating some of the issues. And so if you're not moving because there is a herniation, we've got to fix the herniation first. And we totally can do that. Now, this video I decided to do today because I was literally talking to a personal trainer who came up and asked me questions like, hey, I have this client who has back pain and the pain goes down the leg into the outer part of the foot, having a hard time going up on the toes on that one side. And I'm like, yeah, definitely has sciatica, definitely has nerve involvement. You have weakness. The nerve involvement based on going up on your toes is L5-S1 at that very lowest level. That's depending on weakness in parts of the foot, we know kind of where the nerve is being pinched. So we don't even need an MRI to kind of tell us. And so he was like, yeah, I was wanting to go and give them traction. Traction's another thing that you should not have to do for your back pain. So traction, all it does is just pull everything apart, but then you go back and you're lying down against gravity, and then you go back to gravity, and then it's like, oh, there, my pain is coming back again. I'm like, no, I wouldn't do that at all. And he was doing things like in these positions where he was raising the leg up, and he's like, man, it hurts him every time he does it. And I'm like, I would stop doing it. There's going to be a direction that we can move into that's going to reduce that herniation. And it's one direction, not all directions. And when this is the reason why yoga doesn't always help, because you feel good with the movement, but you're moving in all these different directions. But in reality, when people come in here and there is a joint that's not moving, usually it's one direction that needs to be moved repeatedly at, and that's what opens everything up. So think about it. If we've always been putting pressure on the front, what happens is all the material moves to the back, and when it moves to the back, it can pinch the nerves, which then can give you pain down the leg, pain into the hip. It's a referral pattern is into that hip. So you can have all this pain in the hip and not even have back pain, but it actually really be coming from the back as well. And so when that happens, and these discs, they have rings that go around them, and these rings keep everything intact. And how do we know that they're intact? Well, you can change your position and make it better or worse. You feel better with movement. These are all things that we know, okay, if there's a mechanical issue, we definitely can solve this. Your pain can come and go. Even if it's constant pain, you can get in a position to make it better. These all gives indications that the disc is totally intact, because it would present differently if it were not. So then we just are going to use the hydrostatic pressure of these ligaments that go around it. They're called, it's not really ligaments, but they're called annulus. They go around these for the sake of it makes sense, but they're pretty thick. It protects everything. It keeps everything in there. We're going to use that to do repeated motion to move everything away. Now, you can have herniations anywhere on parts of these discs. The majority of them, 80% of the time, it's in the back. This is why the majority of the time when you do this one exercise that I'm going to show you, it's going to work, because the majority of the time it's in the back. You can have herniations in the back and they're a little bit more lateral. You can have them directly lateral. You can have them a little bit more in the front lateral, and you can have actually herniations in the front. I've seen it before. It doesn't happen very often, 1% of the time, and we're looking at probably 15% of the time where there's a lateral component to this. But we use motion with our proprietary evaluation that we do, where we take baselines of moving you, repeated motion in a direction that based on our evaluation that we think is the direction that we need to go into, and then we move you again and see what's gotten better, what's gotten worse, and that's how we figure out how we can get to the source of the problem. Now, with back pain, we've discussed this before. You can have stuff in the upper thoracic or lower thoracic that can create issues. You also can have stuff in the hip, and a lot of times there's combinations of things too. But we have to rule out the spine first. We have to rule out the back first. And if you are doing, bring your knees to the chest. If you're doing hamstring stretches, if you're doing core strengthening, or if you're doing your knees side to side, stop. It's not going to work. Don't, you're wasting your money. There's other things that we can do that can help. So this is the exercise that I want you to start doing that's going to give you some relief today. We'll start out slow. And you can get some baselines of bending forward and seeing, how does it feel going forward, going backwards. You can go and do side, move your hips to the side, move your hips to the other side. Just kind of see how it feels. What does the pain feel like? How far can you go down? What's the quality of the movement? How easy is it for you to move? Just take those in your hand and to keep an idea of what's going on with your body. Then we're going to hang out on your elbows. And so this, again, 80% of the time, extension is the direction that we need to go into for the back, because what do? We sit, we bend, we clean, we're always bending forward, and we never reverse that direction. And eventually over time, our body goes, I can't do this anymore, and it'll make you hurt. So you can start out this way and doing this. A lot of times if movement is what feels better, like if I get up and move around, I feel better, then the next one that I'm going to show you will be a better option for you. But when you just kind of want to see hanging on your elbows, just extending your back, getting a little bit of extension through the back is the way to go. So you can do this for a minute, 2 minutes, get up, retest the motions. If you get up and retest the motions, don't be afraid. If you go forward oh man, I am so stiff. Very, very common. Don't worry about it. Let it settle, go back through, and you'll notice okay, now I actually can go down, and that's not a big deal. I describe that as if you go and hang out, like here, your knee in range, and you've been there for a while because you've been on the couch and your legs are propped up, on an ottoman or something, and there's no support in the back of the knee. When you come out of it, you're like, oh, wow, I'm a little stiff because I've like been in range for that knee. But then within like 10 seconds, it goes away. Same kind of thing here. So don't freak out. That is totally normal. So if your body's like, oh, I like movement better because moving around makes me feel better, then this is the exercise you're going to want to do. So you're going to have your hands underneath your shoulders, and we're just going to kind of bend up and then come back down. Really relaxing the glutes. Don't let them tense up. So you just want to lift up and then come back down, and then lift up and come back down. You may have some soreness as you do it. And then what happens as you keep on doing it, it may feel a little bit better. It may feel about the same. But again, stand up, go through those motions again to see how you're feeling. And notice if you're moving better, then we know this is the right direction for you. So these are great exercises that you can do, that you should be avoiding the other exercises that if you're giving those exercises in your physical therapy sessions, then you just need to stop going to them. They are not going to be helping you. If they're doing dry needling and all those kind of things, you can't move, you need to go into the mobility first. Mobility is our first phase of treatment. Then we get into stability, because if you can't move, you physically are going to be moving around something and you're not going to be able to get the correct muscles to fire, and you'll just be going into those same patterns that have been hurting you. So, which is why a lot of times when you go into core strengthening immediately, you may actually feel worse, especially into the hip. If the hip's not moving because of the back, or the hip's not moving because of the hip, you go into course and go into some strengthening for those hip muscles, and you can't move, it will make you worse. We see it all the time in our office. So again, my name is Stephanie. I'm the owner of Empower Physical Therapy. We help clients avoid surgery, injections, and medications, and really to help them feel their best as they get older. No need to sit on the sidelines and be like, oh my gosh, how's my life going to be? And I can see the rocking chair getting closer in, and I'm going to have to deal with this for the rest of my life. No, we're here to tell you, when you can get to the right people, it's a game changer for your life. It's a game changer for getting you back to feeling your best and getting you back to doing things actively and playing with your kids and grandkids and all those things. So I'm here to tell you it is possible. We have in the description, there's links of other resources. We'll have a back pain, kind of a free ebook on back pain and some things that you can do, and with some really good video testimonials, as well as kind of taking you through a step-by-step process. So if you're interested in that, go into the description and make sure you subscribe to the channel. Share this video with someone that needs to hear this message. Comment if you have any questions or anything below, and we'll see you next time.